Welcome to Washington, D.C., and thank you very much, Mr. Adwan, for the introduction. And I hope you enjoy the weather. For it's just a little humor on our part. I couldn't be more delighted to be here and to be with you this morning than to talk about President Obama's drug control strategy. We're greatly appreciative of the invitation to be here, not only from the International AIDS Society and AMFAR, but for all of you, and the chance to have a bit of a conversation. And we have several staff members that'll be here throughout the day, and so I think if there is follow-up information, we would be delighted to participate and to be of some help. Neither this meeting nor the International AIDS Conference, which is so historic that will follow this here in Washington, would occur in this city without President Obama's leadership. He corrected the policy restrictions that banned individuals with HIV to travel to the United States. He could not make it more clear that he has an administration that relies on science rather than dogma to inform policy. To some of you in the audience, I may look like an unexpected messenger, a police chief who delivers a message about addiction as a disease and treatment and prevention and health care as the primary tools, and not about the criminal justice system or a war on drugs. But frankly, my colleagues for many years have had very much the same position and have repeatedly talked about that. After I had this position and talked with the Wall Street Journal about ending the war on drugs, and not calling it that it was really a terrible misnomer to use war on drugs as an analogy for what is truly a public health issue. I was asked, well, what about the members of Congress? Aren't they going to see you as being soft on drugs and soft on crime? But I think after 37 years in law enforcement, it's just a little hard to paint me as soft on drugs or soft on crime. But we know we needed to be much smarter about the way we address this issue. And I came actually into this, into the HIV/AIDS world with a much better and fuller understanding of this problem than I did with the science around the disease of addiction and the understanding of treatment. When I was brand new and being tested police chief in Florida in a place called Fort Pierce, which, as some of you may know, had and had for many years one of the highest per capita infection rates in the country, in a fairly small community. I had a young officer who was HIV/AIDS positive, and as he became less healthy and weaker, and this was 1992, so long before lots of drugs and treatment, as he became less healthy and weaker, I assigned him to the front desk. And after he would get off his shift, I noticed that the people that replaced him were taking Windex and alcohol and squirting it over everything and wiping everything down. And I really realized that the people in that department didn't have an understanding of what this was. And so we brought in experts. Back then, the experts were not as many and not as knowledgeable, certainly, as today. But we did huge training sessions for all of the people involved to help understand what this disease is and what the disease was, and that wiping everything down with alcohol and treating him as an infectious individual made absolutely no sense. And you would think that sometimes police officers who were very brave and carry firearms would be more knowledgeable and become better understanding. But I think the fault was that we didn't spend the time giving them the education and the information about this. And then my wife did some real groundbreaking work in this area also with the sheriff in San Francisco many, many years ago in talking about people who were incarcerated and were also HIV positive, and how corrections officers and others should better understand it. So I really had a much fuller understanding of this issue, and couldn't be more pleased and more proud to see how far all of us have come in treatment, in recognition, and I think this issue of the twin epidemics of IV drug use and HIV is particularly important that we address that. Well, over the years here in this country, and certainly in some others, but our drug policy has just lurched back and forth between people who say, look, everyone needs to be arrested and incarcerated, and that will solve the drug problem, and other people who say, well, look, if we just legalize drugs, that will solve the problem. We don't think that either approach makes a lot of sense, quite frankly. Spending more money for prisons and enforcement increases arrests and seizures, but it isn't going to solve the problem. And for my colleagues in this room, and one of them, the Assistant Chief Jim Pugel from the Seattle Police Department, who will be speaking to you later, often talk about we are not going to arrest our way out of our drug problem. We don't believe that either of these approaches is humane, compassionate, realistic, and we don't believe either approach is grounded in science. And neither acknowledges the complexity of our nation's drug problem. War on drugs is a great bumper sticker. I mean, it really fits well on the back of the car. Unfortunately, it isn't a solution to a really very, very complex problem. That's why our national drug control strategy, President Obama's national drug control strategy, actually pursues a third way. The 21st century approach to drug policy is this third way. It's progressive, it's innovative, it's evidence-based, and we really believe that it paves the way forward not only for the United States, but we think it can be quite helpful in other places around the world. And we have done an awful lot of work with counterparts in other countries. The health consequences of drug use are many. Today, the drug-induced deaths are the #1 cause of injury death. We have more deaths from drug abuse than from car crashes or gunshot wounds. Injection drug use is a well-known route of transmission of bloodborne infections, particularly HIV and hepatitis B and C. And in addition, the use of illicit drugs is associated with increased rates of TB and STDs. The facts underscore the need for this different approach, and one that treats drug addiction as a disease and promotes interventions through a public health system. Despite the fact that drugs and crime are intimately linked, we know that arrest is not the answer. We're taking action to reform public health and safety systems so that we can learn to recognize the signs of addiction and act before a substance use disorder becomes chronic. And we know that our screening, brief intervention, referral to treatment programs, and bringing the drug use issue into primary care rather than set aside as a silo is also a better answer. And reforming drug policy takes time. We've made progress, and over the past 3 years, we've spent over $30 billion to support drug prevention and treatment programs. That's more than we spend on federal law enforcement. And recognizing that drug use is a public health issue, last year the Obama administration released its first ever national prevention strategy, which calls for eliminating health disparities and increasing education. And then it's important for us to remove the stigma associated with drug addiction and to support the millions of Americans in recovery. And so in September, when we have recovery walks all over this country, from small communities to very large cities, tens of thousands of people who are in recovery and are able to be back doing the things in life that they want to be able to do, we support them. And we have worked very hard to remove a number of stigmas around recovery. And to break the cycle of crime and drug use, we tried to divert nonviolent drug offenders into treatment through jail, instead of jail, through our drug court programs. There are 2,600 drug courts in the United States. They divert over 120,000 people annually into treatment and help to remove also any criminal justice stigma that was associated with their early intervention. And believe me, I'm a big supporter of the criminal justice system as being a part of the solution and understanding it. It just shouldn't be the only solution. And finally, the Affordable Care Act for the first time makes drug treatment a required benefit for all Americans who suffer from substance use disorders. And this way, our third way approach to drug policy supports the administration's policies on HIV prevention and treatment. So we've made significant progress in reducing the number of new HIV infections among injection drug users and their sexual partners. And the Centers for Disease Control and Prevention estimates that injection drug users represent 9% of new HIV infections in 2009 and about 17% of those living with AIDS in 2008. 1 in 5 of the estimated 1.2 million individuals in the United States who are HIV positive are unaware of their infection. So it's imperative that we enhance efforts to make HIV screening and then the linkage to care for those infected to be much more readily available, and particularly among the most affected groups. Well, we work closely with the Office of National AIDS Policy in the White House and the Department of Health and Human Services. We were involved in the development and implementation of the National AIDS Strategy that was released in 2011. It's a collaborative process. We were able to ensure compatible goals and actions in our respective national strategies. Let me give you a couple examples. The National HIV/AIDS Strategy recommends coupling HIV screening with substance abuse treatment programs, and that's a key step in the nation's effort to prevent the spread of HIV in communities where it's most heavily concentrated. And advances in rapid HIV testing technology allow for HIV testing to be offered in a wider variety of settings, including substance abuse treatment programs, as well as in correctional settings. And it's particularly meaningful because approximately 14% of all people living in the United States with HIV in 2006 were released from a correctional facility that year. And in addition to the disproportionate rates of HIV, inmates have a high prevalence for other infectious diseases, substance use, and mental illness. I often used to say that it should come as no surprise to elected officials when someone is released from prison and hasn't gotten the treatment or the care or the support that they needed to be able to re-enter society, that they turn around and re-offend and go back through the criminal justice system. And yet I've seen now very positively a number of governors in a number of our states, which is in the United States where most of the criminal justice work actually gets accomplished, make changes in their budgets to provide these kinds of services behind the walls, but more importantly to help people re-enter society in a way that isn't going to lead to recidivism. Furthermore, the vast majority of inmates that are going to be released after incarceration back into the community, the number of sentences has been reduced, and in fact, we were able to, under President Obama's leadership, reduce the minimum mandatory sentencing around crack and powder cocaine, which had existed for some time, and both Presidents Clinton and President Bush had attempted to reduce. But in a bipartisan effort and with the leadership of the President, that was the first minimum mandatory sentence program that has been reduced in the last 4 decades. However, we fully also support the interventions that were listed in the PEPFAR technical guide for countries and strategies for a comprehensive approach to HIV prevention, treatment, and care for injection drug users. And that guide focuses on 3 central elements: the community-based outreach programs, sterile needle and syringe programs, and drug treatment, including medication-assisted treatment. Let me take a moment to clarify that policy on needle exchange. In December of 2009, President Obama signed the 2010 Labor, Health, and Education Appropriations Bill into law, and he ended the long-standing ban on federal funding for needle exchange programs. And in the administration's inaugural National Drug Control Strategy in 2010, we made specific reference to the importance of informing public health systems on implementing needle exchange programs as part of a comprehensive strategy to reduce HIV transmission among injection drug users. In my experience as a police chief, both in Buffalo but also in Seattle, with needle exchange programs could not have been and was more positive. The needle exchange programs were partners. They helped in neighborhoods. They helped people get into care that perhaps without those programs normally might have continued not getting into treatment programs. So I think that among my colleagues, we were strong supporters of this. And as you know, though, Congress reinstated the ban on the use of federal funds for needle exchange programs that are conducted in the United States. And before I conclude, just let me stress the United States condemns the human rights violations that are passed on to drug users. And they've raised concerns, and we have raised concerns about the practices that we consider human rights violations. For example, mandatory labor is not a preferred treatment for drug addiction, and we have made that voice known. Our concerns are based on the absence of due process, ineffective practices, reported levels of abuse in facilities that only contribute to malnutrition, other diseases, and things that actually can be prevented. And where countries continue to engage in human rights abuses of drug users and or refuse to adopt effective programs, we're going to continue to work with them while reaching out to the civil society and the non-governmental entities to ensure that people get access to services. And I was just recently in a country 2 weeks ago in which a very high-ranking official said, consumption in our country is of minor concern. And I had just finished leaving a treatment center where I met with a number of women who were in drug treatment. And I thought, you know, you really probably are not getting out to see the effects and the devastation that drug use can have, even in countries that are particularly poor. Well, our objective in every country in which PEPFAR works is to save lives by keeping HIV-infected drug users healthy so that they can live to benefit from effective treatment, and preventing every new infection that we can, and promoting an inclusive approach to service delivery that has to be respectful of human rights. Respect for the human rights and the elimination of stigma and the discrimination are key priorities in the United States. And in many countries, legal, regulatory, and policy reforms are needed to ensure an environment that is created that supports prevention, treatment, and care. And in other countries, the issue may be a need for greater coordination between public health and public safety officials. We've never seen better cooperation than what this terrible economy has wrought here in this country. There were perhaps groups that did not collaborate, did not coordinate, did not work together in a variety of governmental systems that, because of the issues around budget and the very tight, austere budget process that we're all engaged in, are coming together and joining hands and working together to be supportive. Finally, the stigma around the discrimination remains a challenge everywhere, and training and capacity building need to take place to combat them. I've traveled for well over 3 years on behalf of this administration, and I've met people all over the world, but particularly here in the United States, that are in recovery and that are doing an absolutely marvelous job of being back, taking care of their families and back in their neighborhoods. And I do, and the people in my office do everything we can, not only to support them, but to tell people in this country that people can recover from drug addiction. And it wasn't that long ago that methamphetamine was considered that once you were addicted to methamphetamine, you could never recover. Well, I've met literally hundreds and hundreds of people that have completely and fully recovered. We're committed to supporting a balanced public health and a safety approach to reducing drug use and the consequences. We absolutely applaud the work of the International AIDS Society and AMFAR to promote these policy discussions because that's the way forward. And it's only by cooperation and understanding each other's viewpoints that we will make progress. We hope we will come out of today's meeting and this week's conference with a renewed understanding that the debate around HIV and intravenous drug use is not a zero-sum game between public health and public safety interests, but it is rather a critical convergence between the two. Thank you for the invitation, and thank you for allowing me to be here today.
Thank you,